Hello, everyone. Today we will be talking about the manifestation and treatment of schizophrenia, and my U number is the one displayed below. So first, we must begin by defining this neuropathology. According to the American Psychiatric Association, schizophrenia is a chronic brain disorder which, according to some theories, it affects both the mesolimbic and mesocortical pathways. This then causes the following symptoms: delusions, hallucinations, disorganized speech, trouble with thinking, and lack of motivation. Schizophrenia affects around 1% of the United States population, and with the right treatment, these symptoms can be managed and alleviated significantly. According to the monoamine theory of schizophrenia, one of the causes of the symptoms are a result of excess dopamine in the mesolimbic pathway, a pathway from the ventral tegmental area to the ventral striatum. This is due to the fact that too many dopamine neurotransmitters bind to the postsynaptic receptor in the mesolimbic pathway. The positive symptoms are those symptoms that are added to a patient's day-to-day life. Those include both delusions and hallucination. It is worth mentioning that these are the symptoms schizophrenia is most known for. However, it is only half of the full story. Also, according to the monoamine theory of schizophrenia, one of the causes of the symptoms are a result of a deficiency of dopamine neurotransmitters in the mesocortical pathway. That's from the ventral tegmental area to the DLPFC. This phenomena causes the hypofunction of an individual, which is also known as the negative symptoms. This imbalance of dopamine in the mesocortical pathway makes way for the negative symptoms seen in the patient. Those include disorganized speech, trouble with thinking, and lack of motivation. Next, we will discuss treatments to make this neuropathology manageable. The main treatment for schizophrenia is antipsychotics. However, there was a significant stigma against schizophrenia patients, and therefore the first antipsychotic was not developed until the late 1950s. However, there's ongoing research on newer antipsychotics that could lead the way for better life expectancy and well-being for schizophrenia patients. This early and widely accepted antipsychotic is chlorpromazine. It was developed in the 1950s and is considered one of the most significant advancements in the treatment of neuropathologies in history. It blocks dopamine in both pathways and therefore alleviates the positive symptoms significantly. Side effects include and aren't limited to dizziness, Parkinson-like symptoms, restlessness, and agitation. The newer antipsychotics, synthesized in the 1990s, include both clozapine and Abilify. Clozapine blocks both serotonin and dopamine function and alleviates both positive and negative symptoms, whilst Abilify restores dopamine and serotonin activity when needed. These are both full and partial agonists, respectively. The side effects include, but are not limited to, lightheadedness, weakness, vomiting, and weight gain. It must be noted that the efficiency of these treatments is maximized when combined with psychotherapy. There's still ongoing research about the effectiveness of these drugs, and advances are always being made. Thank you for listening.